today we're going to be talking about blood types. This is an amazing chart to really understand what blood types interact with one another and which ones don't. So up here we can see the different types of blood. We have A, B, AB, and O blood type. And over here we can see the red blood cell type, what's found on the surface of those red blood cells, so those are the antigens, and as well as the antibodies that are found in the plasma of the blood. So not directly on the blood cell, but in the plasma. So let's start off with A blood. So as we can see in group A, we have these A antigens that are on the surface of the red blood cell. So what an antigen is it is a molecule that sits on the surface of a cell that basically alerts the body of whether or not that's your cell or not. So antigens are helping you determine whether or not that cell is yours or not and help communicate with other types of cells. Antibodies, on the other hand, are pretty much the opposite. So antibodies will attack specific antigens. So for example, in the group A blood, they have anti-B antibodies floating around in the plasma. So again, not on the red blood cell, but in the plasma. So what that means is if there is a B antigen that comes into the blood or the plasma of someone with these anti-B antibodies, it's going to attack that cell. So B blood cells, not good with the A blood cells. Similarly, for group B, we have these B antigens on the surface of the red blood cell, and it has anti-A antibodies. So these antibodies are going to fight off the A antigen found on the group A blood cells. If we look at group AB, blood AB, as we can see, it has both AB antigens, has both A and B antigens, and no antibodies. So what that means is any blood can be given to someone who has AB blood, and there will be no negative interaction there because they have no antibodies. So since there are no antibodies, it's not going to negatively react with anything. There is no blocker in the AB blood. It's flipped for O blood. As we can see, O blood type has no antigens at all, but has both the anti-A and anti-B antigens, meaning that it will fight off any cell that comes into the plasma that has either A or B antigens. So group O can only accept blood from someone else who has an O blood type. So A only can accept blood from A or O. B can only accept blood from B or O. Group AB can accept from A, B, AB, or O. This is the universal receiver. Whereas group O is the universal donor. It can only receive from group O, but it can donate to any other blood type because there are no antigens on the surface of that cell. So think about it as these antibodies. This is determining what that specific blood type can interact with. So group A cannot interact with B, group B cannot interact with A, and group AB can interact with anything, and group O cannot interact with A, B, or AB. And when we're looking at the antigen side of things, this is what is going to be put into the other blood, essentially. So if group A was given to group B, it's going to give it that A antigen. Not good, doesn't go well. Group A gives that A antigen to group AB. That's fine because there are no antibodies on AB. And lastly, looking at O, if a blood type A is given to O, not good because there's that anti-A antibody in group O, so that doesn't work. So looking at a clinical application with mothers and pregnancies. So if a mother has a type O blood and she is pregnant with a fetus that has A, B, or AB blood, this can be problematic for the mother. As we talked about, a mother with O blood type has no antigens and both antibodies. So if a fetus has AB or AB blood and that mixes with the mother's, then the mother's body is going to deem that as foreign and bad for the mother. So these antibodies are going to begin attacking the A or B antigens or both in the fetus's blood that's mixing with the mother's plasma. This is really only in about 15% of pregnancies does a mother have O blood with a fetus that has AB or AB blood type, and only 4% of that 15% can cause real issues within the blood. This can happen with that first pregnancy of a mother. It doesn't matter if it's her first, second, third, fourth pregnancy. If that baby has a different blood type from O, that can be problematic. So where does positive and negative come into play? Well, it's really similar to the AB, and O antigen and antibody scenario. So let's talk through it. So the Rh positive and negative is referring to positive and negative blood. So when we're looking at the Rh positive blood, it does have these positive antigens on the surface of the red blood cell, as we can see here. It does not have any antibodies. So that means that it can receive blood from both positive and negative blood. When we're looking at Rh negative, there are no antigens on the surface of the red blood cell, no antigens. However, it can develop these positive antibodies. These antibodies aren't always prevalent or at play, but they can be developed. So for example, if there's a transfusion of blood from a positive person to a negative person, then that negative blood can begin to develop these positive antibodies. So again, Rh positive blood can receive from both positive and negative. However, negative blood can only receive from negative. So the universal donor would be O negative, and the universal receiver would be AB positive. So here's another clinical application looking at mothers who are pregnant. So if a mother has a negative blood type, so no antigens, potentially having these antibodies, and she's pregnant with a fetus that has a positive blood type, this can be problematic. If this is the mother's first pregnancy and she has negative blood, the fetus has positive blood, typically there is no issue. However, when the mother gives birth, there is typically an exchange of blood between the mother and the baby. And when this happens, the mother will begin to develop these antibodies. So like I said before, typically these antibodies aren't present, but they can be developed. So if a baby's positive blood has these positive antigens, comes into contact with the mother's blood, then the mother's blood can begin to develop these antibodies. So if a mother has another pregnancy and that next fetus has a positive blood type, these positive antibodies that have begun to develop after that first pregnancy can begin to attack the red blood cells of the fetus. And this is called Rh disease. If not treated, this can cause a miscarriage, this can cause brain or heart issues or anemia. However, nowadays it's pretty common for a woman who has a negative blood type during pregnancy to get a shot during pregnancy, as well as within 72 hours after giving birth. Essentially what this shot does is it gives the mother these antibodies really quickly, so that it doesn't really recognize these antigens that are coming from the fetus during that mixture of blood, and so it's squashing it before it can develop. It's kind of similar to a vaccination. Rh negative blood type is pretty interesting. About 15% of Caucasians have negative blood, about 4% of Africans have negative blood, and less than 1% of Asians have negative blood. So take a little dive on the internet and see what you find about this Rh negative, because there's a lot of conspiracy theories about this blood type and where it originated from. Fun fact, I actually have A negative blood, so maybe I'm an alien. So maybe I'm an alien. So in this chart, we can really determine which blood types can be transfused. So here I have the receiving blood type, and here's the giving. So can A receive from A? Yes, it can. Can A receive from B? No. Can A receive from AB? No, because the B antigen is going to negatively react with the anti-B antibodies on the A blood. And can A receive from O? Yes, because O does not have any antigens, so it is the universal donor. Looking at B blood type, can it receive from A? No. No, it cannot, because it has those anti-A antibodies. Can it receive from B? Yes, it can. Can it receive from AB? No, because this has the A antigen, which is going to negatively react with those anti-A antibodies on the B blood type. And can it receive from O? Yes, universal donor. What about AB? AB can receive A, B, AB, and O blood type. It has no antibodies, so there's nothing to block it from receiving any other type of blood. Whereas O, on the other hand, cannot receive from A, B, AB, but it can receive from O. Because the O blood type does not have any antigens, but it does have both of those antibodies for the A and B antigens, so it can't receive from A or B at all. So this is really just putting everything together. The only thing that this isn't including is that negative and positive blood type, but remember, positive blood can receive from both positive and negative. Negative can only receive from positive. So the universal donor is O negative. O negative is the universal donor that can give to everything. Universal receiver would be AB positive. That would be the universal receiver. So look at it from going this way of like O can only receive from O, AB can receive from anyone, B can receive from B or O, and A can receive from A or O. So hopefully this helped to put together all of the blood types for you and helped you understand it a little bit. Be sure to hit that like and subscribe button so that you can be notified for future anatomy videos.